HIV stands for HIV immunodeficiency virus. It's a very important virus that has been around the world and in Papua New Guinea since in the 80s, and in PNG it was in the 1987. So when you talk about HIV, you think of HIV as a virus that attacks the body's defense system. So when you talk about the body's immune defense system, it's your immune system. So immune systems in the body are very, very important. They ensure that someone who is exposed to an infection or any foreign substance for that matter, some sort of a response should happen within the body to make sure whoever is exposed to infections are safe using their own body's defense system. So the immune system is a very important system of the body that HIV attacks. And once the HIV virus attacks the immune system, it makes it very hard to fight off infections, simple infections like diarrhea or a cough. So when you talk about HIV, when someone catches HIV, that diarrhea that comes on will not eventually be taken care of by the immune system, and then diarrhea gets worse. Or if someone catches a small cough, if HIV is there and immune system is suppressed, it just gets worse. So they keep on coughing, and it affects the quality of life. HIV is the virus. I want to make it clear because a lot of people do not understand it. So sometimes people say you have HIV and AIDS, but from here, HIV is a virus and AIDS is the disease. Someone can have HIV and yet not have AIDS. AIDS develops over time. So HIV is human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. Acquired basically means that someone has to decide to get it. HIV is not the same as TB. TB is a airborne disease that you can, if you travel in the bus and someone has TB is coughing, you will get it. But HIV is something that you decide to get. So it's acquired immunodeficiency syndrome. So it's a virus that you can get. So so AIDS happens when HIV severely damages the immune system, and it takes about 4 to 7 years. And if someone is infected early in the infection, they do not show signs and symptoms. But as they progress into the second or third year, they start developing common infections, which gets worse, and the frequency also increases. So that's a sign that your immune system is going down, and you might be wading into the AIDS phase. But here's the most important part: there is treatment available for HIV. So HIV is a manageable disease, and someone who is exposed to a risk, who is tested, who is diagnosed to be to be positive, they can be treated and they can live normal lives. And that would prevent them from developing AIDS because the virus is suppressed by the drug, the HIV antiretroviral drug, and that keeps them from developing AIDS. HIV spreads mainly through body fluids like the blood. If you're exposed to the blood, you stand a high chance of catching HIV. Or semen which are like from men, like in a simplified way, like the fluid that carries the sperm is called semen. And semen is the fluid that the virus is able to move through during a sexual intercourse or sexual contact. And then you have vaginal fluids. So it does move through vaginal fluids, and also the breast milk. Breast milk is very important, usually for the children. Because as we go on, you would realize that about 7 babies are infected every day in Papua New Guinea. So that is a lot. So we need to understand how HIV spreads from one person who is infected to someone who is not infected and is now taking that risk to be exposed. And the main ways in Papua New Guinea, over the last 20 years when HIV was in PNG is through sexual contact, unprotected sex. A lot of people are taking that risk to have unprotected sex with someone they do not know, and that's about, if you take that risk, there's about 95% chance that you would catch HIV through sex. And then you have sharing needles. Sharing needles is very important. I need to talk about it here because now you have drugs like methamphetamine on our streets. This was something that we thought never existed, but now you have different groups moving these drugs, and Papua New Guinea is probably in a transit point for these drugs. And our biggest fear is, could there be drug injection? So I want to commend UNICEF for just identifying drug injection. And there are anecdotal evidence that there could be some drug injection going on in close groups, and that is very important. So sexual contact, sharing of needles through use of drugs, mothers to baby is very important. About 15% is from mother to child transmission. And a lot of our babies, like I said, about 7 babies per day are born with HIV. So that is something that we could prevent, but it's not happening. And then, like when babies are born, like they can catch it during delivery, when their moms are going through the process and they're exposed to blood. And usually when the delivery is delayed, that stands a higher chance. And then postnatal, when babies are born, and like it's natural to be on breast milk. So babies are born and then they're put onto the breast milk. So if a mom who has HIV, who has not come to do a test, because across country we are testing all the mothers who are pregnant and who want to have the antenatal clinic. One of the important tests that happens is for syphilis and HIV. So unless we diagnose them, we would not know whether they have HIV or not. So if they deliver a baby who is born, suddenly is put on breast milk, the chances of transmitting HIV from the mother to the baby, that's known as the horizontal transmission, can happen during that first few years. And a lot of babies come very late to the children's outpatient and eventually admitted to the ward and they are tested. So it's important to know how HIV is transmitted. HIV is not transmitted through hugging, through just casual contact, sharing plates, clothes. It doesn't happen. So it's through the blood that a lot of times we see. HIV is a important disease in the health system. It has been an epidemic for the last 20 years in PNG. So my role in the department is to make sure that we have testing services that are available, that there's equitable access to testing across the 22 provinces. So my division looks after about 400 testing sites across the 22 provinces. So whoever needs a HIV test can get to the nearest point. So as we speak, every district across the country has a testing, more than one testing facility. So people from the villages can come. We were very strategic not to put testing in villages. We brought it to the district so that people can leave their villages and then come out where they can have a safe space to move in and access testing. So testing, like if someone is exposed, they can easily access test and you can get the result back in like between 10 and 15 minutes. So it's very accessible. And then like ethically speaking, we cannot do test for someone and then diagnose them and leave them alone. So my division is responsible in ensuring that our people, irrespective of their affiliation, whether they are Christians, where they are not Christians, where from the highlands, coast, educated, uneducated, the lowly placed person, as long as they are positive, the treatment is provided through the government. So about 85 to 90% of the treatment is supported by the government. So we test. If they are positive, we lead them into care and treatment. If they are negative, we ensure that the prevention messages in terms of you must wear a condom if you are exposed or you are willing to take a risk. You must make sure you are safe. If you have an STI, you must make sure the STI is treated, and so all these others like behavioral change, and then we have PrEP, which we can talk about it in the future, the pre-exposure prophylaxis. So my division is basically responsible for ensuring that there is testing, free testing happening across country. There is free treatment that is happening across country. We're also tracking the mothers and children if they are positive, and we are engaged in ensuring that people who are on treatment are safe and they are suppressing the virus. So we go as far as the lab. So what basically is happening is we ensure that, and what we have seen in this press release, which we'll talk about, my other responsibility is to ensure that we have visibility and accountability in terms of the testing, the kind of resource that we are spending to show costs and try and identify the kind of burden that the country has. And being working in the HIV space for the last 20 years, I've seen that silence and shame, HIV's best friend. And I say this because a lot of people, if they are exposed at some point in time, they don't want to share it with another person. Or if they are having some medical issues that they think could be HIV, they don't want to come out and do a test. So silence and shame in this time is something that we need to try and address to ensure that our young people are better positioned and better informed. So when we don't talk openly about sexual health, young people make uninformed decisions, and this is something that is more common across Papua New Guinea. Parents do not, at least try to trigger off some conversation about what is happening. So as we are sitting here in the studio and talking about HIV, like I want to appeal to the young people out there, as well as the parents out there who are listening. If you have a son, if you have a daughter who is in uni or is in school or is growing up, they are going to grow up in Papua New Guinea in an environment where infections are already there. So what should we do? So coming here is important to try and inform our young people, and like I said, young people deserve accurate information about their bodies first of all. HIV affects, or in the data that we have shown, 120,000 diagnosed in 24, 60% of those are are women and girls, are females. So 60% are females. So it is important so that to say this at the outset, so that people understand their bodies, they value their bodies, and they take precautions when they are taking risks. If they're in relationships obviously must go on. It must happen so that people can feel that they are part of the community. But those relationships have to be better positioned. It has to be a guided thing. You need to know the other person well. If there needs to be a test, it must happen. And then like the health in PNG. So avoiding these conversations doesn't make the issues go away. We need to grow up with it. We need to understand how things happen and position ourselves. Because if we don't do that, it just makes it worse. Sexual and reproductive health means every person has the right, irrespective of their affiliation, to make informed decisions for themselves, the communities, and about their sexual and reproductive health. So, like for a girl, she needs to know her right, and culture is sometimes confined or suppressed, but those rights need to be clearly reflected in our communities in this time. So, for boys as well. So this right includes access to accurate information, healthcare services, and the right to say no to unwanted sexual activity. This is very important, because now, like in this time, the data is showing that people as young as 12 are infected, and these are adolescents. So if in the health space or in the community, was if an adolescent is looking for some sort of service or care, or some sort of a redress, or some sort of support for their own health or advice, they need to be given. But in our culture and in the systems, you can see that when children of people in that age group, teenagers coming forward, they're usually not served. So I think rights is very important, sexual and reproductive health rights. So it is a given right, and people need to feel free to come forward and get those. So in the health space, we are also emphasizing that as well, so that when you need to take one person at a time. If this is a teenager, please sort them out. If this is a female, please sort them out. Listen to them. If this is a teenage boy, if she comes forward, she needs to be saved, because if you don't save them, they might be catching an STI, for example, and then that might lead into them catching HIV. Because obviously, no one comes to the health facility or ventures out to get support without a reason. There's usually a reason that is triggering off that advancement into this space. So rights are very important. I think it's important to start with honest, age-appropriate conversations. And then, like for parents and teachers and community leaders, they should look out to create safe spaces. And as leaders in different communities, in different organizations, in different places, we need to be looking out to be that person or a place where someone can come and get some sort of a support from us. So that is something that we're working with communities now, through the National AIDS Council, through different community groups. And Care number 1 in the health department is talking about community engagement. So in such situations where you have a high HIV numbers coming up, which now is causing a crisis kind of mode, we're looking at working with communities, working closely with them. So they need to create a safe space where young people can ask questions freely without judgment, so that they can be supported.